Dr. Coria Bayer, former chief medical officer for the New Orleans Public Schools and now assistant professor at LSU, is one of the few who will honestly discuss the problem and joins us now. Doctor, it's good to see you. So much of the conversation about mental health appears to revolve around what kind of drugs to give kids and telling kids it's okay to admit mental health issues. Are we being honest enough about why this is happening and, I'll say it, addressing the root causes?
I think that people are not being very honest about it. And the reason why is because, one of my other accolades, quote unquote, is that I'm the chief medical officer of Dillard University. And we're doing so much right now trying to address a lot of these mental health issues. Across the country, the American College Health Association stats show, and even anecdotally for me, at a university, we would have 5 to 10 patients a year that would have anxiety or suicidal ideations. And now in the last 15 years, I might have, 15 a week of anxiety and one a week of a suicidal ideation. These numbers have jumped up so high and so quickly. We think it has a lot to do with FOMO, fear of missing out. And why do you know about FOMO? It's because of the phones. It's because of all of the overexposure and all of the over information that children get at a very young age. I didn't know what Louis Vuitton was when I was 16 years old. But if you ask a 9-year-old right now what that is, they're like, oh, yes, I have to get my latest shoes or my latest bag. They have too much information and they cannot distill it down to what they need. It's overwhelming. They don't know what they don't know. They don't know what they should know. And then they get anxiety because anxiety comes from the future. You don't get anxiety about the past, and you don't get anxiety and all these depression about the present. You get it because you have anxiety about what's going to happen. And if you don't know what's going to happen, then it makes you nervous. I'll give you a prime example. I have a 9-year-old daughter. And she went to sleepaway camp. This is also anecdotal for me because she went to sleepaway camp for the first time. They didn't have air conditioning, by the way, which taught her how to be tough. But I will tell you that it was like there's so many kids with anxiety at the sleepaway camp. And so this is something that we have to deal with, but we have to deal with it with our children and taking away some of the exposure that we're not regulating right now that's causing all these issues.
It's fascinating, everything you said. There's so many points to it. Mental health, urban versus rural. Suicide increase among teens since 2010. 74% metro area, 40% non-metro area. We keep talking about the urban-rural divide in America. And I'm wondering if it's a little bit about acceptance, right? If it's fear of missing out on being one of the cool kids with anxiety who gets medicine, who goes to therapy, who's in touch. They're celebrated because they've come out and talk about their feelings versus shall we say, a more rural approach, which is go out and work in the fields or go get a job and stop worrying and put down your phone. And it's not quite as accepted.
Yeah, it's the suck it up mentality in the rural areas because they don't have as much exposure. And believe it or not, when you take a child that is in an urban area and then take them to a rural area, they decrease the amount of anxiety. I used to do medical missions in Nicaragua when I would go in Managua, and this was 25 years ago. When I was in Managua, all the children's names were Brandon and Dylan because all the people there at that time were watching 90210, and they had dolor de cabeza, dolor de columna, pain in back and the neck. And I would go out to the countryside every night. And when I go out to the countryside, there was no dolor that way because they woke up by the sun, they went to sleep by the moon, and they did not know about 90210. And that's the kind of life we need to strive for.
Well, 90210 is where it all started. That's where we went wrong.
Exactly.
Doc, it's good to see you. As I said, you're one of the few who will tell the truth about this. Thank you. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.